Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
And we welcome to the program Lee Aase and Dr. David Strobel from the HELPcare Clinic. And first, gentlemen, good morning.
Good morning.
Hey, good morning.
And we've been talking about this for quite a while. Today is finally the day where we get to let you make a big announcement.
Yeah, we're pleased to not only to make an announcement, but also to introduce you to Elizabeth Hedlund, a physician assistant from Owatonna, who's had more than 20 years of experience in practice. She is joining the HELPcare Clinic practice beginning February 2nd as our third provider, in addition to Dr. Dave Strobel and Stephanie Kimmis. So we're delighted to be welcoming Elizabeth to the program today as well.
In adding another clinician, another doctor, if you will, or a family practice person, not specializing, but really this is another family medicine that really covers just the basics of what most people are going to need.
Yes, yeah. So we're still going to be focusing mostly as a direct primary care clinic. So it's mostly the stuff that you normally would go see a regular doctor for. You know, we can usually handle about 90 or 95% of what comes to us. So that's the kind of stuff we're talking about. But just because that's generally what we do doesn't mean that everybody has all the same interests. And family physicians and nurse practitioners and physician assistants and all of these folks that work in this area will often have, will almost always have areas of special interest and expertise that they can offer in different perspectives, and it's just a delight to be able to work with folks that don't all think like you. That way, I learn things from them just as much as patients learn new things from them that I didn't know. And so having more cooks in the kitchen basically makes for kind of a nicer menu.
Absolutely. And people can go to your website. You have a nice article up there and a message from Elizabeth talking about just her background and some of the areas where, I don't want to use the term specializes in because that kind of pigeonholes people's, but areas that she's worked in, because one that jumped out to me is in the area of eating disorders. And, if to have that within your, as you said, menu of areas, that it might be something somebody may have and need someone to talk to.
Well, let's have Elizabeth chime in a little bit about that. So, Elizabeth, welcome to HELPcare Clinic, and also welcome to the radio program.
Sure. Thank you for having me. I'm excited to be starting next week. I have 21 years experience in practicing medicine. 15 of those years are in family medicine. And then a few years, a little bit of urgent care, but then also, working in St. Paul at the Emily program. I did the medical treatment for those clients with eating disorders, and that I worked mostly with adolescents that were in day program, but also I covered some of the residential clients and some of their outpatient clients as well. And so I've always had an extra interest in nutrition, done a lot of research in nutrition over the years, and that's part of what I love about my job is the education piece and helping people with wellness, and nutrition being a big part of that, but also are you moving enough? Are you sleeping enough? Are you managing stress? And even what's your spiritual life? So just addressing each individual holistically, and then to get to the root of the problems. And is there a nutrition issue that we can work on? Is it a sleep issue? How can we help you get to the bottom of what's going on?
Emily, John Wright here from KUS Radio. I'm just curious, what was it about the HELPcare Clinic that attracted you and made you want to join the team here?
Absolutely. Healthcare is such a unique offering, and it's like nothing I'd ever seen in medicine before. And honestly, coming from feeling very burned out from working in a big system, where you feel like you're at the you feel like you're at the bottom of the barrel, and really just you're going into medicine because you want to help people, but feeling at a loss. And so what HELPcare is doing is just bringing that ability back to spend time with people and help people make decisions for themselves. Not just what the insurance companies want you to do, not just what the system wants you to do, but what is going to be best for that person or that family, that child. And so the time, the management, there's so much about it that I fell in love with the concept.
I would think when people go into medical school, and I'm thinking especially in the area of family practice, that there is a kind of a going into it, the vision of being able to work directly with families and more of that individual one-on-one medical care. And that's kind of something we've gotten away from in this country, yet the HELPcare is really trying to bring that back.
For sure, yes. And I would say over the years, I've worked with a lot of really great healthcare providers, and I really do think intentions are good, and people go into healthcare for the right reasons, but the system overall is changing, and it's very different now as compared to when I started even 21 years ago.
Yeah.
Absolutely.
I've always thought that it was just that, if you get the right system, then the people that are in the system can do as well as their skills, abilities, and interests allow them to, because we're mostly a profession of people who, at least at the very beginning, went into this with a fair amount of altruism. Mm-hmm. And then the problem is that the systems make it basically, that's a punishable offense, so to speak. And so you end up beating it out of people, and then you actually can, over time, you can actually become rather adversarial with your patients. Every one of them is threatening your time or your liability or something, and everybody's angry with everybody, and it's all because of how things are set up in a system that just does not enhance that. So we're restoring the soul of healthcare practitioners, and because of that, then the souls of patients are restored as well.
Mm-hmm. So I just say, we originally made connections with Elizabeth through one of our patients, and for patient privacy reasons, we won't say who that was, but she was having a conversation with one of our patients, and so she reached out to us, and we were able to have her come visit 2 or 3 times to really get a sense of who she was, and also then for her to get a sense of what this is all about. And it just is something that as we continue the conversation, as we continue to grow the number of members that we have, the people who need care, Elizabeth will be in the practice here in Austin on Thursdays and Fridays mainly. So that's the plan as we're going forward. And what that'll mean is that most days we'll have probably 2 providers here, each day. And so being able to meet the timely needs, as well as having those scheduled longer visits, will be just much better equipped to be able to do that.
And Elizabeth, just real quick before we run out of time, when you heard of this opportunity and what Dr. Strobel and Lee have been building here, was it like almost a lifeline where you're feeling burned out and you're like, finally, this is the type of thing I really want to do?
For sure. Yep, absolutely. And it was interesting in that having conversations, it was 3 different people who don't even know each other, 3 different situations where somebody said to me, well, maybe you should check out this little clinic in Austin. They might have what you're looking for. And lo and behold, it took me all of 5 minutes to reach out to Lee and say, what's going on down there? So, yeah, it's good.
And the more we talk about this, we've been doing this for about a year now, that I'm amazed that the people who are signing up for the HELPcare Clinic become such an active participant in making the clinic grow and be better. And they're like, I know somebody who could help you do this, or I know a doctor that might be able to come in and be part of this, or they come in and want to be employees themselves. And it's such a cool grassroots kind of thing going on. It just keeps getting bigger and bigger.
Yeah, and it's just Lee and I have mentioned this before. I mean, we haven't posted a single job yet. God has brought us everybody right basically when we needed them, and it's just been such a providential experience, and Elizabeth is just part of that providential work.
Mm-hmm.
Yes, and it just goes to prove when you're doing good things happen.
Yeah, absolutely. It has been very much like old-fashioned barn raising here, where the community is getting together, and that's even then enabling us to spread and be able to serve other communities as we're starting in Rochester as well. So
yeah, absolutely.
It's been really, really blessing.
Yeah, we're way out of time here. Lee, let's just again remind people how they can find out more and what they can do to be part of this wonderful thing that's happening.
Well, great. We'd encourage people to go to our website, which is at helpcare.health. That's HELPCARE.health. They can stop by and see us, which is the best way, because they can see for themselves what's here at 308 4th Avenue Northwest in Austin. It's a block east of St. Augustine's. Or they can give us a call at 507-279-2345, and we'd be glad to talk with them.
Absolutely. Well, very good. We'll hope that everybody does that, takes a look, and finds out if this is just the right thing that they've been looking for as well. Again, Elizabeth, welcome. Appreciate the conversation today, and welcome to the HELPcare Clinic. Lee and Dr. Strobel, look forward to talking to you again next Thursday.
Blessings, John.
Thank you.
Thank you. Bye-bye. The HELPcare Clinic, check it out for yourself here in Austin, and as we've been talking about, expanding too with the new clinic over in Rochester.